What I'm about to show you could forever change the way you view every blood pressure pill in your medicine cabinet. Because if you take Amlodipine, Losartan, or Lisinopril, there's a very real possibility that the symptom you've been ignoring, attributing it to age, stress, a bad night, or simply a bad day, is actually a silent sign that your body is reacting to your medication in a way no one has fully explained to you. And that's the part that worries me most, because most people don't end up suffering from these medications only when they're misprescribed. Often, the real danger arises when the patient doesn't understand what the medicine is doing inside their body, and the signs go unnoticed until something serious happens. If you find this topic important, please like this video and subscribe to the channel so this information can reach more people who really need it. Welcome to this space. If you're new here, you should know that this place was created for men and women who want to stay strong, sharp, active, and independent after 50. And if you're already part of this community, thank you from the bottom of my heart for joining me again today, because the topic we'll cover in this video may be one of the most important for aging with dignity and autonomy. If you've been prescribed Amlodipine, Losartan, or Lisinopril to control your blood pressure, there are 11 things you need to understand starting today. It's not because your doctor wants to hide information. The problem lies elsewhere. Appointments are very short, explanations are often rushed, and too many patients leave the office with a bottle in their hand, but with barely half the information they really needed to hear. By the end of this video, you'll understand which side effects are common, which can be dangerous, which seem harmless but are anything but, and why the most important truth isn't just about the number on the blood pressure monitor, but about whether your body can safely tolerate this medication in the long term. I want to start by telling you about Gloria because her story perfectly illustrates why this conversation is so important. Gloria was 72 years old, organized, disciplined, responsible, the kind of patient any doctor would want. She took her medication exactly as prescribed, attended all her appointments, and never missed a dose. On paper, everything seemed perfect. Her blood pressure had improved dramatically. But 3 months later, Gloria sat across from me, telling me something that terrified her. Her shoes no longer fit the same. Every night her ankles swelled more, and at the end of the day, her legs felt heavy, as if she were carrying something strange inside them. She thought she was gaining weight. Her daughter thought it might be a heart problem, and Gloria was afraid. What no one had clearly explained to her was that the same medication that was helping control her blood pressure could also cause a very specific side effect, one capable of making many people believe that something much more serious was happening. Now, before I show you the part that truly blew me away, the information that takes these tips to an incredible level of understanding, I have to mention something. Everything I'm sharing now about understanding blood pressure medications is just a small sample of what we've compiled in our comprehensive health guide for this stage of life. We've created 4 volumes that address, in a practical and in-depth way, the fundamental pillars of aging with vitality. These are 101 natural remedies for everyday life, where you'll find simple solutions for everyday ailments, the ultimate longevity plan, which guides you step by step toward a longer, healthier life, the complete guide to your heart and blood pressure, so you can take care of your main engine with clear strategies, and men's health after 50, prostate, energy, and vitality, an indispensable resource for men who want to maintain their strength and well-being. There's a special offer available right now to access all of these materials. You'll find the link in the description and a QR code on screen. That's the rest of the knowledge that transforms lives. But let's get back to medications, because what I'm about to tell you is the game changer. Number 11. The first thing that many doctors, simply due to lack of time, fail to explain clearly enough. These 3 medications are not the same pill with different names. Amlodipine belongs to the calcium channel blockers. Losartan is an ARB, and Lisinopril is an ACE inhibitor. Yes, they all help lower blood pressure, but they do so through completely different mechanisms. And when the mechanism changes, so do the side effects and the signals the body starts sending. If you don't understand that, you're going to misinterpret what your body is trying to tell you. Amlodipine often relaxes blood vessels in a way that frequently causes swelling in the ankles and legs. Lisinopril is known to cause a persistent dry cough. And Losartan is often prescribed precisely when a person can't tolerate that cough. Same target, different mechanism, different signals. Now understand why this is more important than it seems. If you start coughing on Lisinopril and think all blood pressure medications will do the same, you might stop treatment altogether. If your legs swell on Amlodipine and you think your heart is failing, you might panic unnecessarily. And if you feel perfectly fine taking Losartan and assume there's nothing to watch out for, you might not realize that a potassium problem is silently developing inside your body. The first hidden truth is simple but powerful. The name on the bottle reveals the drug class, and the drug class shows you the pattern of effects you can expect. When you understand this pattern, you stop being surprised by what you feel, and when you stop being surprised, you make better and faster decisions. And that can often prevent a simple side effect from becoming a real medical emergency. Number 10 is exactly what Gloria was unknowingly experiencing. Amlodipine can cause swelling in the ankles and legs. And this swelling is one of the most misunderstood side effects of all blood pressure medications. People think it's because they ate too much salt. Others think their kidneys are retaining fluid. Some believe they're simply moving less and gaining weight with age. But when it comes to amlodipine, the real reason is usually much more specific. This medication relaxes the small arteries more than it relaxes the veins. So blood flows down to the legs easily, but it doesn't return as efficiently. Pressure begins to build up in the smaller vessels, and gradually fluid starts to leak into the tissues around the ankles and feet. That's why so many people say something like, "I'm fine in the morning, but at night my socks leave deep marks." Swelling doesn't always mean the medication is wrong for you, but it does mean that you should have that conversation with your doctor as soon as possible. Number 9 is something far too many people ignore for far too long. Lisinopril can cause a dry, persistent cough. An irritating cough that seems to never end. And what many doctors don't emphasize enough is this, that cough doesn't always appear immediately. Sometimes it starts within a few days. Sometimes it takes weeks, and in many people, it appears months later, which is precisely why almost no one connects the dots. People blame allergies, dust inside the house, reflux, a cold that never quite went away, or even the dry winter air. The cough usually feels harsh, uncomfortable, and insistent. It doesn't produce phlegm, it doesn't seem alarming, it doesn't sound dramatic, it just won't go away. And because it often worsens overnight, people assume the problem is in their lungs when the real source is sitting quietly in the pill organizer they open every morning. But there's something even more important hidden behind all of this, and I need you to listen carefully. A dry cough caused by Lisinopril is not usually the same as a dangerous allergic reaction. The sign that should really scare you is something else: swelling of the lips, tongue, face, or throat, especially if you start having trouble breathing or swallowing. That's not a wait-and-see situation. That's not something to call the doctor's office on Monday. That's a medical emergency, because ACE inhibitors like Lisinopril can, in rare cases, cause a condition called angioedema, and when it happens, it can become life-threatening very quickly. Number 8 is one of the most dangerous truths in this entire video, because it's hidden in plain sight, even at the supermarket. If you take Losartan or Lisinopril, potassium matters. A lot. Most people hear that and think, great, I don't take potassium supplements, so I'm fine. But it's not that simple, because potassium isn't just found in a bottle of vitamins. It's also in salt substitutes, heart-healthy seasoning blends, electrolyte drinks, hydration powders, meal replacement shakes, and even over-the-counter products that people consume without a second thought. Both Losartan and Lisinopril can raise potassium levels in the blood, and when potassium gets too high, the problem becomes serious because it starts to disrupt the heart's electrical rhythm. The most dangerous thing is that at first it might not make much noise, perhaps appearing as weakness, muscle cramps, tingling, fatigue, palpitations, or sometimes with virtually no symptoms at all. Number 7 has to do with kidney function tests, and this topic confuses people so much that some stop taking their medication just when it might actually be protecting them. Losartan and Lisinopril aren't just blood pressure medications. In the right person, they can also help protect the heart and kidneys over time. But when someone starts taking them, or when the dose is increased, the doctor may order tests and find small changes in kidney function, such as a rise in creatinine or a decrease in GFR. And for many patients, that sounds terrifying. They immediately think the medication is damaging my kidneys. And yes, sometimes it really can be a problem, but other times a small initial change is expected because these medications alter the pressure within the kidney's filtration system. That's why the tests are so important, and why guessing on your own can be dangerous. Number 6 is one of the most overlooked dangers in older adults. Dehydration changes everything. If you're taking Losartan or Lisinopril and then experience vomiting, diarrhea, a stomach virus, loss of appetite, or excessive sweating from the heat, the medication that was helping you yesterday may be affecting your body in a completely different way. Today, your blood pressure may drop dangerously low, your kidneys may start to suffer, you may feel dizzy, weak, or even faint, and in some cases, the body can develop acute kidney failure much faster than the person imagines. The medication hasn't become harmful. What has suddenly changed is the fluid balance within your body, and now the same dose is acting in a completely different way. Number 5 is a silent trap hidden in millions of medicine cabinets, and at first glance, it doesn't even seem related to prescription medications. Ibuprofen, naproxen, just something for your back, just something for your knee, just something for the pain after gardening. But if you take Lisinopril or Losartan, especially if you also use a diuretic or a fluid-removing pill, the frequent use of certain anti-inflammatory drugs can create a perfect storm for your kidneys. And this shocks patients because each one on its own seems perfectly normal. A blood pressure medication, a common pain reliever, maybe a diuretic. Nothing sounds dangerous. But together, in the wrong context, especially if dehydration is present, they can reduce blood flow to the kidneys and seriously increase the risk of kidney damage. And here's another huge problem. Most people never mention the over-the-counter pain relievers they buy to their doctor. They don't even consider them medications. They just see them as something they bought at the pharmacy. Number 4 is the side effect that too many people normalize until it ends in a fall. Dizziness, lightheadedness, that strange feeling when you stand up too quickly. The weakness that appears after the first few doses of any of these 3 medications, especially when starting them or increasing the dose, is because the body may need time to adjust to lower blood pressure. And during that adjustment, dizziness occurs, particularly when going from lying down to standing up. People often downplay it. They say, "Oh, I just stood up too quickly maybe." But in older adults, a few seconds of dizziness can end in a fractured wrist, a head injury, or a broken hip. Number 3, and this is where so many intelligent people unwittingly sabotage their own treatment. They see a single high blood pressure reading and immediately conclude that the medication is useless, or they see a low reading and decide the dose is too strong. But blood pressure doesn't work that way. It fluctuates, changing with sleep, stress, pain, meals, posture, caffeine, intense conversation, and even the anxiety of taking a reading. A single number isn't a sentence. It's merely a snapshot in time. What truly matters is the pattern, the consistency, what your body has been showing you over time, not a panicked glance at the blood pressure monitor on a Tuesday morning after a bad night's sleep and a dash to the bathroom. Medications like Amlodipine, Losartan, and Lisinopril should be evaluated based on trends, not fear. Number 2 has to do with timing, and I can't even begin to tell you how many unnecessary problems arise from this. These medications work best when taken consistently. Same routine, same approximate time, same system. If you miss a dose, the solution is usually not to double it later, unless a doctor has given you very specific instructions. Most instructions say something like this: if you remember the missed dose relatively soon, take it. But if it's almost time for your next dose, skip it and continue as normal. Don't take 2 at once. However, people do this all the time because they're terrified their blood pressure will spike again. Then they end up feeling dizzy, faint, or scared by a drop in blood pressure they themselves caused. And now we come to number 1. The most important truth that many doctors don't always state clearly enough. The best blood pressure medication isn't the one that gives you the prettiest number for 3 weeks. It's the one you can safely, consistently, and intelligently maintain because it truly fits your body, your symptoms, your other health conditions, your lab results, and your daily life. That's the truth so many people overlook. A medication can look successful on paper while quietly failing in real life. Because you hate how he makes you feel, because you don't understand his warning signs, or because without saying anything to anyone you've already started avoiding him. So I want to give you a practical framework to remember whenever you take Amlodipine, Losartan, or Lisinopril. If you're taking Amlodipine, watch for swollen ankles, flushing, headaches, dizziness, or that heavy leg feeling at the end of the day. If you're taking Lisinopril, watch for a persistent dry cough, dizziness, and any swelling of the lips, tongue, or throat. If you're taking Losartan, pay attention to dizziness, weakness, dehydration during illness, and signs that your potassium might be getting too high, such as cramps, tingling, muscle weakness, or irregular heartbeat. With Losartan and Lisinopril especially, blood tests matter. With all three medications, consistency matters. And with any of them, a symptom you can't explain deserves to be discussed. Don't wait until you're absolutely certain. You don't need to be completely sure to make a call, you just need to notice a pattern that worries you. And I also want you to understand something else, something that can save you a lot of fear. Not all side effects are catastrophic. A mild headache when starting Amlodipine can improve over time. A little dizziness when your blood pressure starts to drop can also stabilize as your body adjusts. And a dry cough caused by Lisinopril can be annoying without necessarily being dangerous. But that doesn't mean all side effects have to be endured forever, because there's a huge difference between "this will probably get better in a few days" and "this is ruining my quality of life." And so many patients constantly confuse those two things. If you've made it this far in the video, it's because you care about your health and want to live with more energy, more independence, and a better quality of life. That's why in our comprehensive health guides, we share how diet, natural remedies, and simple habits can help you regain vitality, strengthen your body, improve memory, support circulation, and maintain your independence for longer. All with practical changes and easy-to-implement tips. Find our guides by clicking the link in the description and scanning the QR code on screen. 101 Natural Remedies for Everyday Life, the Ultimate Longevity Plan, the Complete Guide to Heart and Blood Pressure, and Men's Health After 50. Everything you need to take care of yourself at this important stage of life is just a click away. Thank you for being here, for listening carefully, and for taking action for your health. See you in the next video.